morning, I am Senroline C. Radam, and today I will be demonstrating the Post-Partum Assessment. So the purpose of this assessment is for the nurse to be aware of the normal physiologic and psychological changes that takes place in women's body and minds in order to provide comprehensive care during this period. So the equipments to be used during this assessment is the sterile gloves, the peripad, and the stethoscope. Now, let us start with the procedural steps. Okay, so the first thing that we are going to do with the procedural steps is to wash hands. The rationale in washing hands is essential to avoid pathogenic microorganisms and to avoid transmitting them. So the second thing to do is to prepare the materials to be used, to easily grasp and use the materials during the examination. The third thing to do is to wear gloves to help prevent surgical site infection. And then the next that we are going to do is to verify the mother's name and birth date. The rationale during this period is to ensure that the patient get the right care at the right time. So, okay, ma'am, let me ask your name. Okay, so your name is Katie Borromeo. And then, may I ask your birth date and your birthplace? Okay, so your birth date is December 7, 1995, and you were born in Quezon City Province. Good morning, ma'am. I am Senroline Siradam, and I am your nurse for today. I will be having your postpartum assessment today, and the purpose of such is to raise awareness of the normal physiologic and psychological changes that takes place in women's body and mind in order to provide comprehensive care during this period. So in order to start this assessment, so let me first proceed with exposing your breast so that I can assess the presence of lumps in your breast area. So may I expose your breast, ma'am? Yes, you may. So thorough inspection, there are no lumps in her breast. Observation also, the breast is pendulous in shape and there is no cracks, lesions, and discharge. Breasts go through so many changes during pregnancy and after delivery. So it is important for your doctor to keep track of what's normal and what isn't. And in this case, for the patient, it is normal. So the next procedure that I am going to do is to feel the temperature using the back of my hand around the breast to make sure that they are within the normal range. Okay, temperature is good and in a normal range. So the next part, we will be assessing the uterus. So in assessing it, we make sure that the mother is laying flat when assessing the uterus, to check whether the uterus is lying in the midline of the abdomen, which the baby is lying in, by the way. Okay, so let me assess your uterus. And this time, we will be exposing the mother's abdomen. Okay, Ma'am Katie, may I expose your abdomen? That would be great. We do this procedure to detect any tenderness or masses. Then, the next step that I am going to do is to put one hand to support the bottom of the uterus and the other hand to feel the fundus. Palpation of the uterine fundus postpartum helps to determine uterine size, degree of firmness, and rate of descent, which is measured in finger breadths above or below the umbilicus. So through palpation, we found out that the mother's fundus is firm. The step is done to assess if the uterus does not contract strongly enough, these blood vessels bleed freely. Since we were utilizing the bubble here as our guide in the assessment, the next part that we will be assessing is the bladder. Okay, ma'am, may I ask you if you have already emptied your bladder? Yes, I already have. Well, that's good, ma'am. I just have a little reminder for you, in case you weren't aware of this yet. I want to encourage you to void every 2 to 3 hours, although you do not feel the need to. Bladder care is important aspect of care in a postpartum period, and it is important that the bladder is then palpable above the symphysis pubis. Did you get my point, ma'am? Yes, I did. Okay, that's great. So, ma'am, the next thing that I will do in proceeding with the said technique is to auscultate the abdomen for bowel sound to allow pinpoint areas where an obstruction may have occurred. Okay, ma'am, may I ask you some questions? So, when was the last time that you ate or drank, Ma'am Katie? Oh, a moment ago before going here. So, what were the food and beverage that you had, ma'am? Okay, milk, vegetables, and rice. And also, you had sky flakes as your snacks while waiting for this assessment. Okay, that's great. So, eating regular meals, ma'am, at set times helps you to get all the servings from the 5 food groups. It is also to help body recover and give you the energy that you need to care for your little one. So, that is the importance of having those meals and tracking your fluid and solid intake. So, now I am going to assess the mother's lochia. So, when was the last time that you changed your peripad, ma'am? Okay, 3 hours ago. That's great. I also would like to take the chance to inform you of the importance that you need to change your pads regularly. It helps to keep you from getting an infection, to help your perineum recover faster, feel better, and help to prevent infection. So, are there any blood clots found in your pads while you change it, ma'am? So there were blood stains, but there were no blood clots. Okay, that is noted. Okay, that's great. Can I change your peripad, ma'am? Okay, sure. So, okay, I have this peripad in my hand. So, I'm going to replace your current peripad with this peripad that I have. Okay, so I will now change your peripad, ma'am. Okay, the next step is the episiotomy. So through observation, the perineum of the mother has slight redness. There is no swelling, no bruising, no edema, and has minimal mucosal discharge. So the next thing that I am going to do is to perform the Homan sign. This time, I will be exposing the mother's legs to assess for adequate circulation by checking the pedal pulses and noting temperature and color. So I will now hold the foot with the other hand and the other hand to support the legs. Next, I will lift the mother's legs and sharply dorsiflex the foot. Okay, ma'am. So, did you experience tenderness on your calf? Okay, none. So, the question is asked to know how well the blood flows in the lower limbs of the mother being assessed. So, through inspection, the right calf and left calf did not have redness, swelling, as well as heat. So the next thing that we are going to do is to note for emotional status. So I will observe the patient um, in how he on how she is acting, and I will I will observe if she is in pain or exhausted or happy or etc. So the mother is somehow happy. So, okay, Ma'am Katie, that was all for our assessment for today, and I just want to commend you for your participation and your readily and actively behavior during the assessment. So, afterwards, we will perform the aftercare towards the patient to ensure safety and comfort. After doing the aftercare, we will document the findings during the assessment. Okay, that was all for this video for the postpartum assessment. Again, I am Sandrine Rodam, a second-year nursing student at Biliran Province State University.